Welcome to This Week in Health IT News, where we take a look at the news that will impact health IT. This is another field report where we talk to leaders from health systems on the front lines. My name is Bill Russell, Healthcare CIO coach and creator of This Week in Health IT, a set of podcasts, videos, and collaboration events dedicated to developing the next generation of health leaders. As you know, we've been producing a lot of shows over the last 3 weeks, and Series Healthcare has stepped up to sponsor and support This Week in Health IT. And I want to thank them for giving us the opportunity to capture and share the experience, stories, and wisdom of the industry during this crisis. If your system would like to participate in the field reports, it's really easy. Just shoot me an email at bill@thisweekinhealthit.com. Now, on to today's show. Today's conversation is with Neal Patel, physician and CIO at Vanderbilt University Medical Center. Good afternoon, Neal. Welcome to the show.
Well, thank you. Thank you very much for having me.
Well, I know you guys are all very busy, so I really do appreciate the time. We've been meeting with a bunch of CIOs and executives talking about the preparation, and I'd just like to really just get into it, but if you could just give us a little background on the University Medical Center, what areas you guys cover, what geography, and a little background, that would be great.
Sure. Vanderbilt University Medical Center is on the campus of Vanderbilt University in Nashville, Tennessee. So we really cover the Middle Tennessee area. We have patients coming in from Southern Kentucky as well as Northern Alabama, some from Mississippi. Tertiary Quaternary Academic Medical Center. We have close to a little over 1,000 beds with a adult hospital, children's hospital, and a psychiatric hospital on site. We average about 50,000 discharges a year and about 2.2 million ambulatory visits a year.
Wow. And so Nashville was actually one of the areas that was starting to really escalate. Has that continued, or is it?
So the good thing that we had was because of our clinical leadership in infectious disease and vaccine development, the worry of coronavirus was actually heeded early. So we actually started testing for coronavirus fairly early in our city. And so we have done a lot of tests, and the confirmed cases have risen. But the good part has been that thus far we have not seen the onslaught into our inpatient environment. We've been preparing for the past several weeks in a variety of ways to be ready for it. But our focus was to get rapid assessment centers and testing out there. Now we're following close to 500 to 600 patients as outpatients to follow their symptoms and hopefully keep them at home. And we're preparing our inpatient facilities to respond as the numbers of inpatient admissions rise.
Yeah, so Academic Medical Center, you probably had a fair amount of technology in place. What new technology have you spun up over the last couple of weeks to address the needs?
Sure. Well, several things. While we've had technology in place, it wasn't leveraged as well as it has been in the past several weeks. First and foremost is what we're doing now, teleconferencing, using Zoom and every other type of platform has markedly increased, and everybody is saying that around the country. We have obviously, as many other medical centers, have really transitioned clinical care in our ambulatory environment to telehealth. We had the integration. We're an Epic-based EHR system here. We've had that in place for the past 2.5 years. And we had our integration with Zoom and Epic for our patients through the patient portal. But whereas we average maybe 10, 20 appointments a day, now we are averaging about 1,500 to 1,600 telehealth visits a day direct to patient.
Isn't that amazing? I mean,
it's amazing how obstacles fall away when it's the only thing you can do.
Yeah, so there's a lot of different kinds of telehealth, and really been pretty lax on the show. But there's obviously the remote visits is important. There's also remote patient monitoring is another aspect of that. Do you guys have any of that going on at this point?
Not yet. And I agree with you. I've been playing with the telehealth world for a while, and telehealth is the big umbrella. And there's really televisit, where you're interacting with the patient face to face, and so it's kind of like an ambulatory visit. There's also things like telediagnostics with store and forward, whether it's EEGs or pictures of retinas for diabetic retinopathy and those sorts of things. And then, as you said, telemonitoring. Well, we haven't really gotten into that space as much. We have other tools that we have access to be able to visualize the monitors remotely, and we wouldn't really classify that in terms of changing our apparatus where we're removing the provider from the bedside. It's more of a surveillance and an oversight aspect by supervising attendings.
How much has physician to physician communication gone up via things like teleconferencing?
It actually has gone up remarkably well. We have been on the journey to do that initially with secure chat or secure texting to comply with the CMS regulations. But now we have also are beginning to leverage and see if Microsoft Teams can be used to do virtual rounding and bring disparate people to the same location, but also promote social distancing, or we should actually more appropriately call it physical distancing, where individuals still need to collaborate on the care of a patient.
I love working from home. You're giving me the full experience. I'm getting some background noise, some things going on back there. You're also using Zoom to its full capacity. If people are just listening to this on the podcast, you have the background going as well. Do you find, so people are taking to this pretty well? I mean, obviously it's hard. We used to work in the office. We'd interact with each other, but are the staff taking to this pretty well? Are we figuring out ways to bring everybody together and sort of break up the monotony and help them to stay focused and talking with each other?
We have been, and we're learning as we go, obviously. One of the big pieces that has been important for our health IT team, we have about 450 FTEs that very quickly had to transition to working from home when they were in the office. And I've been impressed with how professional and diligent they have been. We have really utilized the communication platform in Microsoft Teams to keep people communicating with each other, keep statuses up to date. And really, it's been interesting, whereas before, when we would quote unquote have Skype calls where everybody would just dial in and it was a glorified teleconference with the old telephone, it's amazing how many more people are turning on their video because they want to see the physical interaction, whereas we didn't do it as much when we were in the office, but still, it was still a call with a bunch of remote people. So that transition has been interesting. The other piece that we've done is we've held virtual town halls.
Yeah, tell me about that.
So we've held two of them. The first one was right as we started to work from home the week after, where everybody was kind of naive to all of the actions that were taking place in the command center at the medical center, and how do you get that sort of information to the front lines. And emails or just giving updates in the written form just isn't enough. And so we were able to leverage our Zoom capability, and the first kind of did a update with what was happening nationally as well as locally and at our medical center, providing the clinical background to our IT staff. And we had 450 people on that town hall virtual, and it was amazing. And we also used it for a little bit of fun. We had people submit pictures of their home work environment that they had to throw together, and so we got amazing community building out of that process as well. And then the post survey of that town hall, people actually begged for more, and they said, gosh, it'd be great if we had this weekly or every 2 weeks. And so we did another one this week, which was 2 weeks later. And again, this time 460 people dialed in at 8 a.m., which I found pretty impressive, that there is a thirst for being together in some format and hearing a common message. And so it's been gratifying to know that our team can come together and that people can share, despite all of us dealing with all the various things that we have to deal with home life and worry about safety.
Yeah. What's over the last couple of weeks? A lot has changed. What's one of the things that you've discovered that you were like, this is a real good finding that might help others, or just something you might want to carry forward?
Sure. I think most institutions are finding the fact that our frontline clinicians have transitioned to do telehealth visits when in the past they would have never considered such an option. Now, obviously, it's easier to do now because there is no other option, and you're not having to switch back and forth between live patient visits and telehealth visits. But the fact that there's been very rapid uptake and adoption of the technology with very little quote unquote teaching or educating has been rather impressive to us. And it gives us the confidence that we can move quickly on certain things and not to just let the enemy of good be perfect, which oftentimes we get in trouble with in terms of trying to perfect something or perfect a solution before getting it out.
Yeah, I'll say it's that CIO, an acting CIO doesn't have to say, but there was a lot of barriers to telehealth before this. I mean, the compensation model, that barrier came down. Even the security, restrictions, we had to go with very specific technology platforms. The physicians, quite frankly, pushed back significantly. At least when I was trying to roll it out, they pushed back significantly on the fact that they had to do televisits, they had to do in-person visits. Their workload was so, it wasn't designed to really take digital into account. Well, all those things happened to fall away over the course of, a week, 2 weeks?
Exactly. And I think that's still, if there are going to be silver linings around this horrible, horrible cloud, though that's one of them. All the factors fell into place to actually get over that activation energy that's required for people to at least try it. As some of these obstacles or barriers rise up, we're going to need to now, but at least think about how to overcome them as we move forward. But the reaction from the patients has been the most impressive thing. The positive feedback that we are getting from patients has been absolutely tremendous. And that sort of validation that the clinicians are hearing is pretty profound.
Yeah, it's amazing. I just got off the phone with my mom. She's 80-something years old. She's like, I just had a televisit. She was so happy because she listens to the show and she's just like, I now know what you're talking about. That was really good. Like, yeah, and I think that's what's going to happen. The Net Promoter Score on this stuff is so high that people are going to go, they're not going to want to go back. So right. we're going to have to figure it out.
Between the televisit and also, we've had a significant uptake of our patient portal, which is, we had developed a homegrown one before we went to Epic, and then we just transitioned it, but branded it the same, which is called My Health at Vanderbilt, but just utilizing the MyChart functionality in Epic. We are signing up 7,000 patients a week now. We were already closing in on 500,000 patients, and now we're skyrocketing because the thing we did at each of our rapid assessment centers is that the patients wouldn't have to call in for their results if they chimed in for the patient portal, because their result will show up as soon as it was resulted. And that was incredible. And people, again, found a reason to connect.
Yeah, so it's more than just the record. You're giving them the results back pretty quickly. Yep. Can you schedule televisits through there and actually instantiate them through there?
Yeah, it's instantiated through the portal. That's how we do all the televisits using the platform.
Yeah, I know. I know that at least back when I was a CIO, one of my compensation goals was to get more people on the portal. This would be a great time. Telehealth and getting more people on the portal were two of the things I was compensated on. This would have been like the perfect year for that.
Exactly.
I would think. But I think people are going to find that those tools, we've been talking about, our Amazon moment or our whatever. People are going to experience those tools and realize that the health systems have the capabilities. They have the the digital chops to make this stuff happen. We just have to, and I hope that's the message that sort of gets to the state and federal government is if we get out of the way, if we move some of these things out of the way, and now that people have experienced it, it'll be interesting. I've sort of framed some of these questions, I think, a little differently, but talk to me about your team. What's one thing that your team has done that's really just been amazing?
Well, I'll actually focus on two things. But we very quickly had to change the structure of our inpatient beds in ways to create cohort-specific units and such, and the agility of our team to coalesce, partner with operations, and be flexible because decisions would change from morning to afternoon depending on new findings or new understandings. And oftentimes IT teams can complain bitterly when operations or somebody changes requirements after they're already been down a specific path. But knowing that we all had to come together and be responsive, that level of collaboration has been just tremendous to see. And creating reproducible models so that we just didn't create a hero mentality of knocking it out just this one time, but everybody realizing that they're going to need to have this for the long haul as we evolve, and creating what I've always prided, create a systematic approach to modularity so that we can do this in a reproducible fashion without having to go through the same one path over and over again and relearn things. And so it's been tremendous to see the teams just embrace that.
Yeah, and this is the last question to really hear. But I saw Stanley McChrystal talked about, one of the things you want to avoid in a crisis is heroes. Right. And it's interesting because you would think the opposite, because when we were growing up, we saw these stories of the crisis hits and the hero. But, what he sort of communicated is you want more like NASA, a team of people solving problems, coming together, operations, IT, and whatnot. And I'm glad you brought that up because I think that is a key point to really getting through this. And one of the things, I mean, if you could talk a little bit about that, how the entire system has really come together around the needs of the community.
Oh, absolutely. From our operation, from enterprise leadership on down, everybody has command centers in every one of their institutions. It's a well-known term, but the key is how is the camaraderie and the collaboration within the command centers, but also the willingness to have robust discussions of what is the right path forward. And that's what I've been most impressed with between our leadership, between different leaders and experts, because this pandemic brought together different types of individuals that usually aren't in the center of the fray. Usually when you have a command center, it's because of a natural disaster or some sort of other issue. But in this, to have our supply chain leader addressing things, to have our HR leader trying to figure out how to support staff and augment staff, to have our infectious disease individuals having to rewrite policies on the fly and provide recommendations and get them communicated out. But to see all those individuals come together and just be in harmony in many ways instead of each struggling to figure out how to work together has been just something to take pride in.
Yeah, absolutely. Neal, I really appreciate your time. We will have to have you back on the show at another time, maybe in a couple of months, and we'll see, how much of this stuff stuck,
Absolutely.
how many televisits are we doing 6 months from now? I think will be an interesting conversation.
Well, I'll be glad to be back and report out, and promise to be bluntly honest.
I appreciate it. Take care. That's all for this show. Special thanks to our channel sponsors, VMware, Starbridge Advisors, Galen Healthcare, Health Lyrics, and Pro Talent Advisors for choosing to invest in developing the next generation of health leaders. If you want to support the fastest growing podcast in the health IT space, the best way to do that is to share it with a peer. Send an email, DM, whatever you do. You can also follow us on social media, subscribe to our YouTube channel. There's a lot of different ways you can support us, but sharing it with a peer is the best. Please check back often, as we will be dropping many more shows until we flatten the curve across the country. Thanks for listening. That's all for now.